Just want to say good afternoon, everyone. We are going to start this meeting of Health and Human Services Subcommittee. Today we have two briefings. One of them is Department of Disabilities, and the second one is the Department of Human Services. And at this time, we're going to call up Mr. Connor Brown so we can hear the readout for the Department of Disabilities.
Thank you, Mr. Chairman. Good afternoon. My name is Connor Brown, Policy Analyst with the Department of Legislative Services, here to present the fiscal 2027 budget analysis for the Department of Disabilities. To begin, on page 1 of the analysis, the fiscal 2027 budget for MDOD decreases by $540,663, or 3.4%, bringing total funding to $15.6 million. On page 2, the federal rescission of the Social Security Administration's Interventional Cooperative Agreement Program, or ICAP funding, is the primary driver of this decline. Although the award was canceled and no funds were spent in fiscal 2026 before the cancellation, almost $900,000 of funding from this program is included in the fiscal 26 working appropriation. Also on page 2, MDOT has two proposed fiscal 26 deficiencies. The first is for around $180,000 for personnel expenses, and the second is to withdraw $450,000 from the Telecommunications Access Maryland, or TAM program. This is due to the Senior Call Check program being double budgeted in fiscal 2026 in both MDOT and the Department of Aging. This deficiency ensures the program is only budgeted once in the Department of Aging. Moving on to page 3, Exhibit 1 shows an overview of agency spending in fiscal 2027. Approximately 37% of the budget supports personnel, the majority of which is within the Office for Individuals with Disabilities. Combined expenses in the TAM program account for 30% of the budget, funding programs like Maryland Relay and the Maryland Accessible Telecommunications Program. On pages 4 and 5, Exhibit 2 outlines line item changes in the fiscal 2027 allowance compared to fiscal 2026. Other than the ICAP grant, notable changes include the addition of 3 contractual positions in the fiscal 2027 allowance, which are discussed on page 6 in the personnel section. These contractual positions will support MDOT's participation in the Department of Service and Civic Innovation's Service Year Option Program, as well as the new Office for Disability Employment Advancement and Policy, which I will discuss later. At the bottom of page 6, the key observations section begins with the Universal Services Trust Fund, or USTF, which is a special fund that supports TAM program expenses. Revenue comes from a fee on telecommunications service bills. Descriptions for the various TAM programs can be found on page 7. On page 8, Exhibit 3 breaks down these program expenditures by fiscal year. In fiscal 2025, Maryland Relay, which provides telecommunications relay services for Marylanders who have difficulties using a standard phone, accounted for 58% of all TAM program expenses. On page 9, fiscal 2026 saw an adjustment in the surcharge funding the USTF. Despite a steady growth in expenditures, revenues were not keeping up. In order to maintain program sustainability, the surcharge was raised from 5 cents per month to 9 cents per month, effective July of 2025. On page 10, Exhibit 4 shows MDOT's estimated revenues and expenditures for the USTF with this new surcharge. In fiscal 2026, the surcharge is projected to raise $5.4 million, slightly exceeding expenses each year through fiscal 2029, though by a shrinking amount. At the bottom of page 10 is a discussion of the new Office for Disability Employment Advancement and Policy, which was established by Chapter 1 of 2025. The fiscal 2027 allowance for this office is $250,000. To prepare for this new office, MDOT has engaged in policy evaluations and listening sessions for implementing Chapter 1. MDOT should comment on preliminary findings from these policy evaluations and listening sessions. On page 11, a new departmental bill would require MDOT to oversee and administer affordable and accessible housing programs. Additionally, it would require MDOT to establish one or more affiliated foundations to solicit contributions. MDOT should comment on how it would integrate the new housing programs and foundations into its existing work, as well as any potential overlaps, challenges, or additional resources needed for implementation. Additionally, MDOT should comment on any potential operational or budgetary impacts of this bill. Finally, on page 12, the Department of Legislative Services concurs with the Governor's fiscal 2027 allowance. And with that, I conclude my presentation, and I'm happy to answer any questions you might have.
Thank you, Mr. Brown. And seeing no questions at this moment, I'd like to bring up Madam Secretary Beatty and her team.
Good afternoon, Chair McRae and members of the subcommittee. I'm Carol Beatty. I'm the Secretary of the Maryland Department of Disabilities, and with me today are Deputy Secretary Ann Blackfield and our Assistant Secretary John Brennan. We also have in the audience Jade Gingrich, who is the Executive Director for the new Office of Disability Employment Advancement and Policy, in case there are any questions. We also have David Bahar here. He's our Executive Director of the Telecommunication Access Maryland program. And lastly, I want to introduce our Global Fellows intern, Leslie Wang. So you have, first of all, I wanted to thank our assigned DLS analyst, Mr. Connor Brown, for his very thorough analysis. You have our written testimony, and so with your permission, Mr. Chair, I will discuss the issues raised by the analyst. We were asked to comment on the preliminary findings from FY26 policy evaluations and listening sessions for the new office, ODEEP, as we're calling it, Maryland as a Model Employer Initiative. This office was created last year by the General Assembly through the Governor's Model Employer Act. To begin the work in the late fall of 2025, our department created a multi-agency work group that has been meeting monthly to create an implementation plan. This group has met regularly to identify state hiring capacity and the challenges related to disability employment, and also to create a plan for state agencies' training needs, refinement of the state hiring processes, assistive technology as a response to reasonable accommodation requests, and successful recruitment strategies. Our director of the new office has had multiple meetings with interested members of the disability community to solicit feedback and recommendations. The interagency work group is planning a disability listening session this spring prior to submitting its final recommendation plan in June of 2026. We were also asked to comment on how our department is going to integrate new housing programs and foundations into its existing programs, as well as potential overlaps, challenges, or additional resources needed for the implementation and any potential operational or budgetary impacts of such a program. If passed and signed into law, Senate Bill 22, House Bill 226 will do two things. First, this bill seeks to establish our current housing work in state statute. This update is technical in nature. Second, it will allow the Department of Disabilities to establish one or more affiliated foundations. These foundations will be designed to support our programs in housing, assistive technology, and employment. This bill was modeled on the structure of HB 717, for the Department of Natural Resources, which passed last legislative session. And we will use existing staff for the initial setup, and we fully expect the foundation to be self-sustaining and operated by a board of volunteers. Beyond our budget analysis, I also want to take this opportunity to inform the subcommittee about a very recent federal action a funding action that impacts our FY26 budget and the proposed FY27 budget. The Centers for Medicare and Medicaid Services informed the Maryland Department of Health recently that funding for the long-standing peer outreach and support program would no longer be available. This program has been funded through the Money Follows the Person demonstration grant since 2011 by MDH through a cooperative agreement with our department to allow for disabled peers to visit people in nursing homes who are eligible to receive services in the community. MDOD has historically contracted with the statewide network of Centers for Independent Living to perform this work. The CILs were notified by MDH and our department earlier this week with a contract end date of March 23rd, 2026. This federal action will have a significant impact on the MDOD budget and on these community nonprofit organizations and their employees with disabilities. This action will eliminate approximately $200,000 in funding for the contractors for the remainder of FY26 and $705,000 in ongoing annual revenue for FY27. It also creates a budget deficiency for MDOD of approximately $24,000 in FY26 and $92,000 in FY27, which was included originally in the governor's proposed budget. We are working internally with DBM and MDH to address this issue and to find any potential solutions for both FY26 and 27. Finally, I respectfully support the recommendation to concur with the governor's allowance. This concludes my verbal testimony, and we would be happy to answer any questions.
I have one question, Madam Secretary. In reference to the gravity of the federal action that was taken, I know we talked about it as a dollar amount. How many people are impacted? You talked about them being able to utilize this program.
I'm going to ask Assistant Secretary Brennan.
Yes, thanks for the question. So we have 6 contractors and 1 contractual employee that are utilized to conduct the peer outreach and support. So staffing-wise, that includes 19 staff, 13 of which are peers. So peers are, by definition, people with disabilities who have transitioned out of a nursing facility or someone who has helped a family member transition out of a nursing facility. That's who's hired to do this peer outreach into the nursing facility so that they get not a clinical explanation on how they might transfer. So it impacts there, and then there's also 5 support staff. So that's the staffing picture in terms of the impact on the Centers for Independent Living primarily. And like I said, we have 1 contractual employee that we hire directly to perform peer outreach and support. And then we have a share of a percentage of salaries for 2 of our positions that were dedicated to this effort that we've been doing since 2012.
Madam Secretary, seeing no further questions, at this time I just want to say I concur with the comments that you started with Mr. Brown. Thank you for the thorough analysis. And Madam Secretary, just on behalf of the entire committee, just want to say thank you for your partnership, your guidance, your counsel, but more importantly, just thank you for your visibility and how you're always proactive to make sure that we know that you're accessible. So thank you.
Thank you.
Yes, ma'am. Colleagues, at this time, we're going to bring up Ms. Bougel so that we can get the readout for the Department of Human Services, the overview. And I did not mean to forget Ms. Tanya Zimmerman.
Thank you, Chair. I'm Suiksha Bujel, and for Department of Human Services, I cover the Social Services Administration and the Office of Home Energy Program. And I'll let Tanya introduce herself.
Tanya Zimmerman, the analyst for the Family Investment Administration.
Okay, I'll get started. Starting on page 2, we have the funding by source for the Department of Human Services. The allowance for DHS in fiscal 27 is approximately $3.9 billion, which is a decrease of 4.1% from fiscal 26 working appropriation. As you can see, majority of the funds in DHS are federal funds. Moving on to page 3, we have the functional breakdown of spending. 51% of the total budget, or about $2 billion, is allocated for public assistance. The second largest portion is for personnel, which is about 17% of the budget, or $684.7 million. Foster care maintenance payment accounts for 11% of the budget, or $435.6 million. On pages 4 and 5, we have the budget overview for all fund types. For family investment, excluding supplemental nutrition assistance program and Sunbucks, the fiscal 27 allowance totals about $710 million, which is a decrease of $94 million or 13.3% compared to fiscal 26 working appropriation. The largest decrease is associated with supplemental SNAP benefit, which totals $62 million. In fiscal 26, there was a $62 million to support SNAP benefits during the federal government shutdown. The Office of Home Energy Programs allowance includes $300 million in fiscal 27, a decrease of $0.7 million. Social Services Administration's allowance is about $842 million, or a 3.2% increase from fiscal 26. Child support is budgeted at $136 million, a 21.4% increase compared to fiscal 26. For DHS administration, fiscal 27 allowance totals $227 million, which is a decrease of $125.3 million or 38.3%. Total allowance for fiscal 27 for DHS, excluding SNAP and Sunbucks, is $2.2 billion, which is a decrease of $170 million or 7.7% from the current working appropriation. Moving on to page 5, there is a breakdown by fund type. In fiscal 27, general fund totals about $1 billion, special funds total $253.7 million, federal fund excluding SNAP and Sunbucks total $922.2 million, and reimbursable fund total $0.8 million. Federal SNAP benefit in fiscal 27 remains unchanged at $1.7 billion. Federal Sunbucks increases by $1.6 million, totaling $74 million. On page 6 is the budget overview for general funds. For family investment, general fund totals $315 million, which is a decrease of $2.5 million or 0.8%. The Office of Home Energy Program, fiscal 27, includes $46,000 in general funds. For Social Services Administration, general fund totals $573.9 million, which is an increase of $14 million or 2.5%. For child support, general fund totals $24.2 million, increase of $3.9 million or 19%. For DHS administration, general fund total $125.8 million, which is a decrease of $25 million or 16.6%. Total general funds for DHS is about $1 billion, which is a decrease of $9.6 million from working appropriation. On pages 7 and 8, we have the deficiency appropriation for fiscal 26. The total deficiency appropriation for DHS totals $80.2 million, including $40.5 million in general funds. Of these, $32.3 million is for Family Investment Administration, which includes $28 million in general fund, which is associated with penalties in federal fiscal 23 and 24 SNAP payment error rate. Proposed deficiency appropriation totaling $30.2 million are provided for the Social Services Administration for foster care maintenance payments. $10.2 million is provided for DHS administration, including $6.8 million for department-wide call center expenditures and $3.4 million for million for expenses associated with a change in the electronic benefit transfer and system modernization. Starting on page 9 is the proposed budget change chart. As mentioned earlier, the fiscal 27 budget for DHS totals $3.9 billion, which is a decrease of $168.7 million or 4.1% from the working appropriation. In personnel expenses, employee and retiree health insurance increases by $29.6 million. Salary and associated fringe benefits increased by $17 million. In child support administration, cooperative reimbursement agreements increased by $17.4 million. In foster care maintenance payment, there is an increase of $7.7 million associated with foster care maintenance payments. In the Office of Home Energy Program, CIF revenue allocation for energy assistance increased by $10 million. There is a $10.1 million decrease associated with emergency funding that was provided in fiscal 26 due to delays in release of federal funds for 2026 low-income home energy assistance program funds. Moving on to page 10, in Family Investment Administration, there is an increase of $43.1 million associated with change in SNAP administrative match rate beginning October 26. Family Investment Administration also includes a decrease of about $28 million associated with one-time funds to pay the SNAP payment error rate penalties, a decrease of $11.7 million for SNAP employment and training, $10 million decrease associated with one-time funds for feeding organizations due to the shutdown. In assistance payments, there is an increase of $4.6 million associated with temporary cash assistance, $6.6 million increase associated with temporary disability assistance program. It also includes a decrease of $62 million associated with fiscal responsibility funds provided to partially pay SNAP benefits during the shutdown. And it also includes a decrease of $7.5 million due to anticipated savings related to EBT fraud replacement. In DHS administration, there is a decrease of $130 million associated with transfer of Maryland benefit to the Department of Information Technology. On page 11, we have the caseload estimates assumed in the budget. In cash assistance, temporary cash assistance and SNAP supplemental benefit are assumed to increase slightly in fiscal 27. TCA transitional benefit and temporary disability assistance payments are assumed to increase by 8% and 7% respectively, whereas federal SNAP cases is assumed to decrease by 4%. In child welfare, foster care is assumed to increase by 2%, and subsidized adoption and guardianships is assumed to increase by 1%. In child support, TCA collection is assumed to increase by 10% and non-TCA collection to increase by 1%. The budget estimates total collection will be $462.4 million in fiscal 27. On page 12, we have position information for DHS. Overall, there is no change in number of positions in DHS. By administration, regular positions in Social Services Administration, Family Investment, and the Office of Home Energy Program decrease, while regular position in DHS administration increases. There are no changes in contractual positions. In October 25, the Board of Public Works approved abolition of 502.7 positions statewide. Of these positions, 90.3 were from DHS. In addition to this, the transfer of Maryland benefit from DHS to Department of Information Technology transferred 18 positions to do it. Moving on to page 13, the table shows filled positions in DHS by administration in fiscal 24, 25, and 26. In fiscal 26, as of December, the number of filled positions decreased by 20.7 positions. However, the percentage of filled positions increased by 1.3 percentage points. Okay, the first issue starts on page 14. It discusses the fiscal 25 closeout concerns. DHS made several errors during fiscal 24 closeout process and was unable to fully explain the cause of the errors. As a result, language in fiscal 26 budget restricted funds in DHS pending submission of closeout information, which was due October 1st, 2025. DHS submitted a report on October 17th. However, the report only included a portion of the requested information, providing only fiscal 25 expenditures for assistance payments and foster care maintenance payments. It did not provide information on the reversions and cancellations, TANF spending or balance or special and federal fund expenditures as required. Although limited data was provided, concerns about the accuracy of the fiscal 25 closeout were clear, as neither the assistance payments nor foster care maintenance payments detail reconciled with the information reported to the comptroller. Issues identified in the submitted information for assistance payments include total expenditures that did not match the information reported to the comptroller, including reporting a higher level of total spending. Expenditure of benefit were inconsistently reported between documents for some benefits, including fund source, and did not always match monthly data reported by the department. Most documents report approximately 10 million higher in temporary disability assistance program total spending than the monthly data indicates. Expenditures reported for the emergency assistance to families with children program are about 3 million less than the monthly reported data indicates. Some documents misreported federal fund expenditures in the EBT fraud replacements, and no document explained more than 70 million of federal fund expenditures. For foster care maintenance payment, total expenditures did not match the information reported to the comptroller, and it is unclear if the funds were used to resolve fiscal 24 shortfall of 8.1 million. DHS delayed in responding to DLS questions, and as of this writing, most questions were unanswered. Although not submitted formally, DHS did provide additional information that was intended to be included in the report, which provided explanation on some reversions for general funds, but not for federal and special funds. During the fiscal 25 budget hearing, DHS had noted major challenges during closeout stemmed from lack of use of fiscal management information system to keep track of internal finances. DHS had reported that starting fiscal 25, all unit budgets had been loaded into the system, signaling better tracking and closeout process. However, the closeout issue has persisted in fiscal 25 closeout as well. DHS should discuss its efforts to reconcile its fiscal 25 closeout and plans to improve its closeout processes to ensure that reporting to the comptroller reflects actual expenditures. DLS will make a recommendation related to the reporting of closeout information in DHS administration. DLS received a budget amendment that was part of the closeout on December 19th. The amendment requested to increase special fund appropriation by 20.5 million and to realign 69.2 million and 192.7 million in general funds and federal funds respectively. The amendment did not provide clear reasoning for the appropriations being realigned or increased. For example, the amendment realigns general funds to increase child welfare services appropriation by 55.4 million. However, the closeout reports reverting 26.7 million from this program, indicating that nearly half of the funds transferred were not needed. The amendment also requested appropriation of 7.6 million from the child support offset account. The opening fund balance for this special fund was reported in the amendment as a negative 80 million in fiscal 25, with a closing balance after accounting for the amendment of negative 98.8 million. DHS requested fund be appropriated from the account despite the negative starting balance. As of January 26th, DHS had not provided explanations to questions raised by DLS. The second issue is on page 16. It covers the Office of Legislative Audit's review of budget closeout transactions. The report published in December 25 includes 4 findings for DHS, all of which were repeat findings. One finding determined that DHS could not verify whether federal fund revenue entries were accurate or properly recovered. OLA also found that DHS did not identify questionable accrued revenue entries, including 339.1 million revenue accrual in an account that only had 33.2 million in federal expenditures in fiscal 25. OLA's report also included two findings noting unresolved deficit balance. One found that DHS had 103.6 million deficit balance in a non-budgeted fund account that may require general funds to resolve. In the second finding, OLA reported that DHS had a deficit balance in certain special fund at the end of the fiscal year that may require general funds to resolve if special funds are not available or are not permitted to cover these deficits. The last finding noted that DHS had not reported a combined 28 million potential general fund payable that resulted from federal penalties. These penalties were associated with SNAP payment error rate for federal fiscal 23 and 24. DHS should provide an update on the status of the recovery of federal funds. DHS should also discuss its plans to address finding related to unresolved deficit balances.
Page 17 begins issue 3, which relates to the Temporary Assistance for Needy Families, or TANF, update. Funding through TANF is primarily provided through a block grant amount, which is largely unchanged since the program's initiation. Maryland has annually received $228 million since fiscal 2017. Maryland has also received TANF contingency funds each year since the Great Recession. Contingency funds are available to states meeting certain criteria related to SNAP participation or unemployment. Maryland continues to qualify for these funds because of the SNAP caseload changes since the period it's compared to, and as long as the criteria remains unchanged, Maryland would expect to continue to qualify for those funds. The budget assumes that they will receive about $26 million in each fiscal 26 and 27. There have been, during the last year, 2 lapses of the authorization for TANF. It's operated under a series of temporary extensions since 2010. They often occur with the continuing resolution, so the TANF authorization expired with both shutdowns that have occurred. The lapses were temporary, and because the states have fund balances, it doesn't have a direct impact on the funding of the programs, as long as there is a balance. Exhibit 1 on page 18 presents information on the changes in the TANF spending between fiscal 26 and 27. The total fiscal 2027 allowance from TANF is about $260 million, an increase of $10.4 million compared to fiscal 2026 after accounting for some proposed deficiency appropriations. The largest area of increase in spending, about $6 million, occurs in the Local Family Investment Program, which is the program where caseworkers are budgeted. Local Child Welfare Services increases by $3.6 million, and assistance payments also increases primarily due to higher estimated costs of TCA. Exhibit 2 on page 19 shows how the TANF spending is broken down proportionally. In general, Maryland cash assistance is comprised more than 40% of TANF expenditures. In fiscal 2027, this is 43% of the allowance of TANF programs. Combine the core TANF programs, including cash assistance, work opportunities, and the family investment and administrative expenses comprise 68% of the appropriations. In recent years, the child welfare-related spending has comprised a larger than historical share of expenditures and was about 31% in fiscal 2022. The fiscal 2027 allowance has these at about 18%, which is lower and would be the lowest since fiscal 2019. However, DLS notes that these expenditures in the budget are often lower than what occurs in the actual expenditure. Turning to page 20, this takes a look at some of the risks to the TANF balance. There's a significant risk in the fiscal 26 working appropriation and 2027 allowance for the department related to their TANF to support their planned expenditures. Based on the information reported by the department to DBM, the closing balances would total $11.1 million in fiscal 2026 and $6.3 million in fiscal 2027 because they plan to use some balance in fiscal 2027 to support expenditures. However, as discussed in the earlier issues, in both fiscal 2024 and 2025, DHS made errors in their closeout and has been unable to explain its reported expenditures. This leads to significant questions about the amount of TANF used in those years and undermine the credibility of the estimated balance. The net impact is uncertain, and it will remain so until the numbers are reconciled and explained. In addition, the balance data presented by DHS significantly increased the fiscal 2025 starting balance compared to what was presented last session, increasing from $57 million to $73 million. It's not clear how such an increase could have occurred, and it leads to questions about whether expected recasting of fiscal 2024 expenditures to assist in resolving fiscal 2024 shortfalls occurred as planned. Although if this is accurate, it would lead to higher balance than might otherwise occurred. It's not clear if it's accurate or if the fiscal 2024 shortfalls were addressed. There's also potentially unrealistic assumptions of TANF spending in fiscal 2026 and 2027 on various programs that pose a risk to the balance. So in both fiscal 26 and 27, the Work Opportunities Program spending is budgeted about $8 million lower than the fiscal 2025 reported levels. In addition, the Emergency Assistance for Families with Children spending through November in fiscal 2026 totals $2.4 million compared to a budgeted level of $2.7 million, with monthly data reported by DHS in fiscal 2025 of $6.7 million. So it seems likely that the actual expenditures would be higher than the budgeted level. If the spending on both of those programs is at the fiscal 2025 levels, and all other spending occurs at the budgeted level, the balance would be negative after both fiscal 26 and 27. And we've asked the department to comment on how they're working to reconcile the TANF expenditures for fiscal 2024 and 2025 to determine the availability of TANF and discuss how they will address any shortfalls that might occur following the reconciliation. And that concludes our presentation. And we're happy to take any questions.
Thank you both. Seeing no questions, at this time, we'll bring up DHS.
All right. Good afternoon, Chair McCray, members of the subcommittee. My name is Webster Yee. I serve as the Chief of Staff for the Maryland Department of Human Services. Secretary Lopez sends his regrets to the subcommittee due to illness today. He is not able to attend. First, I want to acknowledge my team here today. To my far left is Jessica Smith, our Deputy CFO. To my immediate left is Roman Napoli, our Chief Financial Officer. Mr. Napoli joins us as a distinguished and seasoned federal budgetary executive. And in addition, we have brought in a new budgetary team around Christmas time, beginning of this year. In addition, as part of my introduction, I wanted to extend the entire department's thanks to Ms. Fujo, Ms. Zimmerman, and Mr. Brown for their various insightful budgetary analyses. And I think we've received over 25 inquiries since January 21st. So keep them coming, guys. We look forward to the conversation. In addition, we extend our thanks to Governor Moore for the fiscal year 27 budget allowance, as well as our colleagues at the Maryland Department of Budget and Management. In addition to members of our leadership here today, we have other folks in our audience, and I would like to call out and highlight our Calvert County Director of Social Services, Melinda Baldwin, who just started as the Calvert County Director a couple months ago. Team DHS consists of nearly 6,000 employees across the state. Our 24 local departments of social services administer 80% of our activities in our $3.9 billion budget, almost 70% of which is federally funded. We serve more than 1 million Marylanders and help empower them to unlock opportunities for themselves and their families. When we began this work 3 years ago, we knew we had to rebuild trust and modernize the system that had fallen behind. And that is precisely what we have done. We have reset our relationships with our 24 local departments and empowered them to better serve our customers through clear direction, resolute support, and customer experience standards. We have taken the time to rebuild our internal teams and functions with a particular focus, as I mentioned earlier, on our Office of Budget and Finance. And the result is, back in 2022, we had a vacancy agency-wide of north of 19%. We're down to about 7% this week. And as we've continued to rebuild DHS, we are going to continue focusing on customer service positions to further improve our customer service. When we took office in 2023, over 40 youth were staying in hotels, and there was no central tracking of these stays. In November 2025, we ended this decades-long practice. We also found, as part of our work, that our out-of-home care provider services and their rates were not directly connected to the level of care they provided. So far, in partnership with the General Assembly, our rate reforms have increased our contracted child placement agency capacity by almost 5%, from 1,921 beds to 2,013 beds. And we continue to tackle this issue, which had been stalled for over a decade. In addition, when we took office, we inherited the nation's second highest SNAP payment error rate at 35%, second only to Alaska. We've cut that rate by more than 60%, and down to 13.64% in federal fiscal year 2024. In addition, after advocating for changes to Maryland's child welfare system in 2024, we launched the Family Matters initiative to promote kin-first practices across the state. As of December 2025, the number of youth living with kin has increased by more than 330 compared to before the kinship law took effect. The kinship placement rate has increased by over 30% in a little bit over a year. In addition, the percentage of kinship caregivers who are licensed by the state has soared from 25% in December 2024 to 86% as of December 2025. Ms. Fujo mentioned Maryland Benefits. That has been a massive focus for us and our partners at the Department of Information Technology. Last July, we launched the Maryland One application, and we were happy to report that over 291,000 applications have been successfully completed since July. Last summer, Sunbucks provided nutritious meals to more than 630,000 students. Importantly, 98% were automatically enrolled based on eligibility for a Netter benefit program. But we're not making it just easier to get benefits, we're making them more secure as well. We were the first state in the nation to replace stolen benefits, first using federal funding and then state funding, to ensure that our customers do not unfairly suffer from global criminals. Since September 2023, we have replaced over $47.4 million in stolen benefits and helped over 73,000 households. We will not be satisfied until no Maryland family is worried about where their next meal will come from, and every young person in Maryland is thriving in a loving home with family by blood or by choice. As we look ahead this year, we remain focused on delivering on the governor's vision to leave no Marylander behind. The first item is improving youth well-being by expanding our Family Matters approach. We will continue to partner with Maryland families to prioritize kinship over youth, support kinship caregivers, and strengthen lifelong bonds. Our second focus is to lead the way on providing secure benefits with the debut of chip and tap-based electronic benefits transfer cards this summer. We are on track to be the second state in the nation, behind California, to implement this technology when we complete the transition to a new vendor this summer. This new technology will substantially reduce stolen benefits from our customers. California reported recently that they were able to reduce stolen benefits by over 80%. Our third priority is to minimize the harm of federal changes to SNAP and preserve lawful access for eligible Marylanders. The SNAP program in Maryland serves over 680,000 hardworking Marylanders, including 260,000 children. Despite the new eligibility obstacles and restrictions put in place by the Trump administration through H.R. 1 of 2025, we will continue to protect Marylanders' benefits by focusing on preserving access, being human-centered, building practical solutions, and welcoming and working in partnership with other state agencies. The fiscal 2027 budget proposal was assembled in partnership with many of you and others who continue to advocate for the Marylanders we serve. We stand ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. I now turn it over to our Chief Financial Officer, Roman Napoli, and our Deputy Chief Financial Officer, Jessica Smith, for our responses to the DLS analysis. Ms. Smith will answer the first question.
In response to question number 1 found on page 15, improving closeout processes means improving the quality and accuracy of our financial reporting throughout the year. It also means making sure our data tells a clear story to our partners in DLS and DBM so they understand what is available and what it means. To that end, we implemented a new process in fiscal year 2025 to reconcile the programmatic caseload data with the cost allocation results on a quarterly basis. This, along with continuing efforts to integrate and improve new cost allocation software introduced in December of 2024, will improve the accuracy and completeness of our data. This year, we are working to integrate an even more detailed level of data at the object level in our cost allocations. We've also improved management controls on the drafting and approving of journal entries to ensure confidence in each transaction. And as we approach closeout, our goal is to correct earlier in the fiscal year many of the relatively small errors DLS identified that could not be corrected after a certain point in the process. We will prepare a number of key documents and reports in this pre-closeout phase so that final updates are made against accurately formulated documents. For closeout reporting, DHS has compiled a list of all relevant documents and templates that DLS requested. With the submission of the JCR data and additional documentation that we provided, we are working to answer any additional questions that may arise. And with that, we will turn it over to Roman, and he will continue to address the additional questions and responses.
Thanks. This is my first time before the committee, so I appreciate the opportunity to speak to some of the additional questions that were raised. On question 2 relating to the Office of Legislative Audits' report on DHS's 25 closeout, I would just note DHS is continuing to work to ensure that at the end of the state fiscal year, we are appropriately reflecting what we expect to recover from the federal government. Part of my job going forward is to make sure we maximize our federal funding each and every year. In just 2025 alone, DHS drew more than $3 billion in federal grants, and that number goes even higher given the analysis that was already given. Last year, my colleagues, Jessica Smith and others, led an effort to aggressively ensure that the data and the tools that we have to manage our federal grants are in place. She already mentioned the new cost allocation software, and let me be clear, this helps us to do monthly and quarterly allocations more effectively and more accurately and prepares us for the eventual closing of the year. DHS is now reviewing prior quarter reports and balances to report adjustments to make sure that any refunds or unreported activity are taken into account, and these are new processes that have been put in place. DHS has also been meeting weekly with the Department of Budget and Management as well as the General Accounting Division from the Comptroller's Office to go through any issues we face in responding to these reviews. Finally, thanks to the Secretary's commitment to rebuild DHS's finance function, DHS has recently hired a new budget director, a new deputy budget director for budget operations, a deputy budget director for cost allocation, and a new senior accounting manager. Restaffing the team is a critical component of ensuring that DHS has the talent and the capacity to meet the moment. Let me make reference to some of the other audit findings just really quickly. And I would flag that DHS is working to clean up the remaining clearing account balance issues that were flagged. These are currently unreconciled, and our goal is to work towards getting them reconciled before the end of the fiscal year. We've also brought in a reconciliation specialist to help us address any special fund imbalances. On the question related to TANF reconciliation, this is only my first few months on the job, but it is easy to see the challenge we face from inconsistency in the federal government as a partner. Regardless, DHS does owe additional clarity to DLS on the current TANF levels. Part of the complexity in reconciling the data is that DHS relied upon available prior year TANF balances to sustain critical programs like temporary cash assistance programs during the federal shutdowns. Thankfully, DHS has ensured that funding was available for this very situation, and TANF-funded programs ran smoothly during the federal closures. During this period, DHS has remained exceedingly conservative in our TANF spending to ensure that we could make it through. Even after the shutdown, DHS has had to actively pursue HHS to get our TANF award. It wasn't until January 6th, nearly a month and a half after the end of the shutdown, that we finally received our first TANF award from HHS. Even then, that award was only through February and the next shutdown. So now the federal government has not provided us our next TANF award, and it leaves us wondering when the remaining award will finally come. While the funds were provided in the recent government funding bill, we should not have to wait another month to get the next tranche of funding. It's my belief that as soon as we have the complete picture of 2026, that DHS will ensure that the sufficient funds are available going into 2027. And for now, we know that we have sufficient 2026 and prior year funds to get us to the point where we can bring that reconciled answer to those that need to know it. And that's all for us.
Happy to take questions, Mr. Chairman.
I'm sure it's going to be a number of questions. I'll start off with just two and make sure that I leave some room for my colleagues. Mr. Chief of Staff, you started the conversation with the word trust, and I just want to lean in and add credibility to that. So we're having a discussion about fiscal year 2027, but fiscal year 2025 has not been reconciled. And you can take the opportunity to answer that question in reference to trust and credibility, but my specific questions will be in reference to what date do you expect for fiscal year 2025 to be reconciled? And how will you share that information with the Department of Legislative Services, knowing that that's the agency to help us have a backstop, safeguards to be able to understand what the respective agency is doing?
Mr. Chairman, that's an excellent question. I can tell you that Roman and Jessica are working night and day in their free time to reconcile fiscal year 2025. We're working with DBM, and then as soon as we get our numbers straight, we will work with DLS on fiscal year 2025. Colleagues, would you like to add any additional information to that?
No.
Okay.
I guess
We understand it's a challenge ahead of us.
what is the expectation or what is the goal? So I asked a specific question. I talked about credibility. I started off with what you said with trust. Are you going to have it in Q1? Are you going to have it in Q2, Q3, this year, next year? Like, what is the expectation? What should we be working towards and looking out for?
Mr. Chairman, I think the expectation is we want to get it to you as soon as possible, and certainly while the budget is being considered and debated. And so the answer is we are working night and day to get you the answers. We're hoping to get it done in February, and we're hoping to get it done sooner than later. It is murderously complex on our end.
So if I'm hearing right, February is you all's goal?
Yes, sir, because again, you all need to have information so that you're able to get a budget out.
Okay. Second question, in reference to question 2 with the legislative audit, and we talked about the $1.3 billion. Can you speak to what specific federal programs were sampled? And at this time, from the audit itself and today, how much has actually been recovered? And how are you all documenting, but more importantly, as we talked about a safeguard, a backstop, how are you all coordinating with DLS to be able to help us understand what we have in front of us?
Yeah. So OLA sampled 55 different items in their review. 45 of them were sort of positively beneficial, meaning that we were over where we wanted to be with our accruals, and 10 were in the negative. So the point is, we have now closed our federal fiscal year, and now we have the ability to see across all the various amounts of drawdowns that we have with the federal government. Right now, we do not have any deficiencies with the federal government that we're aware of. So in essence, we've been able to draw down in Q4 and reconcile that. This is something that's new to me. I'll just say, having not come from the state system, one of the things that I'm learning is when we close the books in June, we still have another quarter of federal funding, and then the federal government gives us an extended period to reconcile with them. So in essence, we're constantly reconciling with them all the way from the last day of June and in some cases into January and beyond. So it's a very long process for us, but we do know for sure that right now we have drawn down and we are making any changes that we need to make. I think it is important to just say something on top of what Chief of Staff Yee said, which is the comptroller's books are in essence closed. We do not make changes after a certain point against those books. So a lot of this will be reflected in when we come and show our data for basically as part of the 2026 closeout. So there are, at some point we stop talking about 25, acknowledge where we were, changes that needed to be made, and then we have to start looking towards 26, which frankly is only 6 months away.
And I believe that OLA should have it, but if you can get us a list of the programs that was in that sample, that would be helpful. I didn't hear you speak to what has been recovered since that audit.
We'll be happy to, Mr. Chairman.
The amount that has been recovered?
No,
or
we'll be happy to give you that list and we'll work together.
Okay, speak to the amount that's been recovered.
And so, to be able to give you a detailed amount, we have to get back to you on that one, primarily because we need to go through all of our grants and make sure that we give you the numbers that correlate to what was responded to comptroller. And again, as the CFO Roma has stated, because of the way the federal grants report and the way that we are allowed to draw down those funds, we have until October. Then we have a 90-day grace period to also draw down any remaining funds. So before we give you a number, I would like to go back and accurately give you good detailed information to be able to provide that to you.
Yeah. I'm going to get to my colleagues, but I also just want to say in a response, words matter. So when I read things like does not reflect any real or perceived harm, because folks are not speaking to it in specificity, being able to get us to understand and we're the backstop, we're the safeguard. So let us make that judgment whether we see any challenges that's there. Senator Jennings and then Senator Augustine.
Thank you, Mr. Chair. Webster, it's not fair for you to be sitting there like that. I'm being honest. The Secretary needs to be there. I understand he's sick. I think we should have postponed this if he couldn't make it. This agency has been under a lot of heat the last 6-7 months. And we're sitting here and I'm reading, the analysis and what's happening, and, it's bad, and you know it. And I'm not pointing this at you. I have all the respect with you. We served together over in the House when I was on committee, you were staff. It's just, I don't think it's fair that you're sitting there and the Secretary's not. The governor puts his budget together, working with your agency and DBM, and that is done, behind closed doors. That's the way it is. When it comes to the legislature, this is our chance to put daylight on it, where we can see it, the public can see it, and we can dive into it. This is the first hearing of many, because, we do the overall, which is this, and then we're going to dive into each one. And I will tell you, normally in some of these, we kind of listen to them and not many questions and we go on. This year's gonna be different. I think we're gonna dive deeper into them. We're gonna have some pretty tough questions because it's bad. I mean, the way that, you mentioned that the youth in hotels was at 40, but it ended in 2025. We kind of glossed over why, because we lost a child. Somebody died. There's some serious issues out there. That need to be addressed. And, I'm not trying to hammer the Secretary, but he is the Secretary. He is the stop. Nobody above him other than the governor. And we're talking millions of taxpayers' money that we're trying to figure out where it's going, what's happening with these audits. Our Legislative Services Department agency works for us. They're the ones who go and review this stuff, provide it to us so that we can make decisions on where to allocate money, what's going on, and try to find it. And I just wanted to say, Mr. Chairman, Disappointed the Secretary's not here. He needs to be here, and I look forward to him on the next hearings. I do have one question. This one's more specific. I'm just curious on it. On page 10, when you guys moved the Maryland benefit to do it, what was that Maryland benefit? I'm just curious of what Do It is taking over responsibility for.
Sure. And Senator, first, I think, again, Secretary Lopez fully expects to have those tough questions, and he is fully prepared to answer them. We are absolutely committed to working through those really tough questions. Senator McCray just raised a couple extra ones. We will go back. We'll break out the pencil.
Thank you.
We'll work it out. Again, with all of our numbers, prior to 2023 especially, but even in 2023, we realized that we did not have that degree of fiscal transparency to really figure out what was happening in our finance systems. We have since taken steps to fix that. With respect to your question, sir, about MD benefits, that is the renamed MD Think. And so prior to July 1st, DHS was in administrative control, if you will, of the state's major technology platform for health and human services.
Got it.
The biggest of which is the enrollment and eligibility system. That does all of the computer calculations for Medicaid and SNAP, basically. On July 1st, that went administratively over to the Department of Information Technology along with the PINs. So you see that big swing of 70 or however many PINs plus the $100+ million. That just was saying, hey, it used to be at DHS, now it's a Do It.
Okay. Thank you.
Yes, sir.
Look forward to talking to the Secretary when he gets here. And, you know, again, it's as the Chairman said, it's not only its trust, it's the accountability is the big thing. And I know you guys have a big agency. It is huge. I think it's, what, number 2 compared to Department of Transportation with what you have to manage. And you have serious issues that you have to manage for people. It's just, we have to answer to the public and let them know what is going on. And that is what I'm hoping we do in the next couple of weeks through all the hearings that we have coming up. So, Mr. Secretary, or Mr. Chairman, thank you.
Yes, sir.
Senator Augustine.
Thank you, Mr. Chair. Looking in, but first of all, I am very disappointed that the Secretary is not here. I just am. This is my first one with this, Webster. You and I have worked together on a lot of other things like this. I'm distressed by what I see here, actually, and what I'm receiving here. Throughout the presentation, there seems to be a lack of control consistently throughout this presentation that they've shared with us. What is going on?
Senator, I think the very transparent answer is this agency we came in with 40 years of problems, and we've been trying to frantically fix things for over 3 years now. In every area that we've looked, every time we peel back another skin of the onion, layer of the onion, we found more problems. And so just when we thought we've fixed things, we found more problems. And we found problems upon problems. My colleagues here at this table have spent the past couple of months rebuilding our data systems. Our DLS colleagues repeatedly say, hey, when are we going to get the data? And the answer is sometimes the data we get from our internal folks is contradictory, or it's just flat out wrong. We then take the time to fix that. Once we believe that we fixed it, we pop it out. And then again, our colleagues say, hey, that A and that C didn't quite match up. So we have to go back and fix it again. The important part on our end, to Senator Jennings' point and yours, sir, is we acknowledge when we've made a mistake and we try to fix it. With the death of Kanaya Ward, we fully embraced that a tragedy occurred. We have taken the steps to fix things by ending hotel stays. We are continuing to do everything we can now to end hospital stays. And a lot of that work goes at the front end. With the kinship care law that was passed, we're now able to get kids into kin care, which reduces the load and reliance on out-of-home placements. And so with each of the conversations over the next 6 budget hearings, Senator Augustine. We fully expect to be called out. We fully expect to have conversations with this committee, and we fully expect to say this is what we did, what we found, where we're going.
Okay. Also, in keeping with that, I just want to share, like, I'm looking at the written response, and I just find it insufficient to what the questions that were asked here. It's not specific, nor was your response right now, quite honestly. Like, I expect more, better. I mean, this is just not responsive to what was being asked. And so what I would say is, I would just ask that there be a more in-depth response to the questions and be responding to that as we move into this next set of conversations and everything else. I just really hope that it's far more responsive. I mean, I appreciate the fact that you guys put in a whole bunch of stuff, you know, in front of it about the things that are happening and everything else. But there are very specific questions that were asked to be responded to that were buried at the end and not really done too well. So I just ask that you guys really dig in, because these numbers are big. And like I said, and relook at this report as a whole and respond to it. I'm hopeful that we'll get that. Will we? Will we get that?
Yes, sir.
Okay, thank you.
Senator Zucker.
Thank you very much, Mr. Chairman. Yeah, I think for the agency, I think part of what the greatest concern is what behind the numbers in terms of the impact to the people that you're supporting as well. So I guess, and I know we'll get into this probably further, Mr. Chairman, at a future subcommittee meeting, but so currently are there Maryland residents that we care for currently being housed in hotels?
No, sir.
What about hospitals?
As of this morning, we have 7 individuals in a hospital overstay, of which 5 of them have placement plans and 2 of them do not.
And when do you expect the other 2 to be placed?
I don't know off the top of my head, sir. Happy to check back. I can tell you that the placement provider teams are working with those hospitals right now. They've been continuously working to get them placed. We are not able to, at the end of the day, create capacity magically, but we are working diligently and tracking them every day.
We'll be asking for an update at the next hearing. Thank you.
Yes, sir.
Seeing no further questions, Ms. Bugel, Ms. Zimmerman, just want to say thank you for your thorough analysis, and we look forward to getting, you guys put a lot of work into what you do, and just making sure that we can be that support system to make sure that the state of Maryland is represented very well, and I just wanted to lean in and double down on saying thank you. Mr. Chief of Staff, I think that you heard the committee very loud and clear. This is the first of many. It's a very long conversation, or it could be longer, but there is an expectation. You heard it from Senator Augustine, whether it's the written responses, just from showing up from a presence standpoint, and the expectation will be met. Colleagues, this is the last respective agency hearing, and look forward to seeing you all at the next. This meeting is adjourned.